Good afternoon. Waziri and the rest of your delegation, Mheshimiwa Mutai Kagwe, karibu sana to Machakos. CAS, Dr. Mwangangi, karibu sana. Government spokesperson, Kano, karibu sana. Naona ukitoka Kano unakuwa governor alafu inaendelea namna hiyo. My deputy governor is here, County Commissioner Esther Maina. Thank you very much. We've got Florence Mwangangi, our Speaker of the County Assembly, our various county officials led by Dr. Ombachi yuko hapa, my friend from many years from the national government. Madam Karibu. We are very pleased that this is the first station that you have chosen to come and deliver your daily brief on COVID-19, coronavirus. It is important to note, and I'll remove my mask at this time. It is important to note that healthcare is not a luxury. Proper and efficient healthcare is a right to many of our people. And that is the essence of devolution. That is why counties have been given the powers and the abilities to be able to treat our people. And we are proud that in Machakos we've concentrated on treating our people. I was very happy to take the minister to the Machakos Cancer Center, where we treat people free of charge, regardless of how much it is, under the Universal Healthcare Program that was initiated cleverly by our President Uhuru Kenyatta. We want to thank the partnership that we've had with the national government that has allowed us to succeed. Corona is real. We have washed hands many times today. We have sanitized. Even nafikiri waziri may notice chakula is tasting different nowadays kwa sababu watu wanaoga mkono sana. Kwa hivyo iko sawa kabisa. Because we are now cleaner and a healthier nation. What I can say is that as a county we support you. We support what the national government is doing, and I urge my people of Machakos to take this as a statement that we are on the highway from Mombasa. We don't allow trucks to stop in Machakos for long. Only 30 minutes na ziendelee. We stopped temporarily the distribution of alcohol. Kwa sababu waziri, pombe ilikuwa inakuja, inasimama nje ya bar imefungwa, lakini stock zinaletwa kila siku. Stock inaletwa kila siku. Tukaona kuna shida. So we are planning to relax it so that now alcohol vehicles can come, but not to closed bars, so that other people can have their drinks as we really keep distance. Kwa hivyo, today is your day. You'll say a few remarks before I'll conclude after you finish, as you take us through. All I can ask is, please, in the spirit of fighting coronavirus, kama mtu si bibi yako tafadhali na bwana yako, kaa kando na yeye kidogo. Naona tumekaribiana sana. Tumekaribiana sana. This is now against the regulations. Na tutaki kuvunja sheria Machakos. Kwa hivyo tusonge nyuma kidogo na tusonge kando kidogo. Ufanya hivi pasikuwe na mtu karibu na wewe. Yes, kwa hivyo tusonge mbali, tuweve hiyo spacing ikuwe sawa kabisa. Asante sana. It is now my pleasure to welcome you. Karibu sana waziri.
Thank you very much, Governor Mutua, my good friend for many years and from a long time. I just want first to thank God for allowing us to be here at this time. I want to thank you and your team for a very warm welcome to Machakos County. And on behalf of the team that I've got here, I want to say jambo to watu wa Machakos. Mwaseo? Mwaseo ringi? Asanteni sana. Leo nimesema badala ya kutubia watu kutoka Nairobi, tufanye kutoka Machakos, na tutaendelea hivyo kutembelea kaunti zingine, ndio watu wajue kwamba hii virusi si virusi ya Nairobi, ni virusi ya Kenya nzima. Na vile vile tumefurahia sana kufika hapa Machakos, kwa sababu tunajua Machakos ni kaunti ya maendeleo. Tumeona mengi, wameendelea vizuri sana. Hospitali tumeona ni safi sana, na Ministry of Health. And this is what we want. The standards that we have noticed here in Machakos all around, standards of hygiene, standards of cleanliness, standards of behavior. Sisi tumefurahia sana hiyo maneno. We are very happy, and I want to congratulate all the health workers in Machakos County. Namshukuru. We are very pleased as a Ministry of Health and as a government. We are very, very pleased with what we are seeing here in Machakos in terms of general health care, but also in containment of COVID-19. So, fellow Kenyans, the national government takes this opportunity to recognize the great work that county governments are doing in response to COVID-19 pandemic. As I have repeatedly said, this is a disease that cannot be tackled by one level of government. This fight requires the entire government and the whole society approach. The collaboration and cooperation between the two levels of government and the people of Kenya has been and has contributed to the gains we have made to fight this pandemic. The national government will continue to work very closely with the county governments and other agencies to strengthen the country's capacity to mitigate against the COVID-19 disease. Today's visit to Machakos County is part of an elaborate plan being implemented by the ministry to inspect the levels of preparedness at the county level and to ascertain the type of support needed. This is important in helping the Ministry of Health to provide support based on the needs per county. Similar visits have been made to Siaya and Kajiado counties and will continue until all the counties have been covered. When we started this fight against coronavirus, our initial focus was on capacity building at various levels. Emphasis was placed on escalating human resources as well as infrastructural capacities. In collaboration with county governments, the ministry rolled out a training of trainers program, and to date, at least 7 healthcare workers per county have been trained. This will now cascade downwards so that all personnel in all counties will have been trained. Today, we can proudly say that over 11,000 healthcare workers across all counties have gone through training. Besides capacity building, the Ministry of Health is committed to improving working conditions of healthcare workers, and will ensure that their safety at the workplace is a top priority. We are aware that our healthcare workers sometimes work under very difficult environment and very difficult circumstances, where they are at risk of contracting the disease from the patients that they manage. This is a major concern of the ministry. To mitigate this, the ministry continues to provide personal protective equipment to various health facilities for use by our health workers. The good news is that we are no longer going to import PPEs anymore. Our local manufacturers are now able to produce better quality than those that we were importing before. The issue of shortage will soon be a thing of the past. Additionally, the national government has committed to support county governments recruit 5,000 community support workers in order to enhance their human resource capacity and in order also to create opportunities for our young people, particularly those in the health working sector. This process is at different stages of completion. Once finalized, the counties will have an additional 5,000 workforce at the expense of the national government. I am happy to note that the Machakos County is among the very first ones that have completed this process. I congratulate you, Governor Mutua. And I'm therefore urging the other counties that have not done so to expedite the process. The restrictions have largely contributed to the low numbers of counties like Machakos, the restrictions and cessation of movement, that we have made across the counties as is necessary. For instance, the one in Nairobi and metropolitan area. This is, however, not to say that Machakos and other counties are completely safe. On the contrary, just like the governor has said, you are at risk, particularly because you are in a transport corridor. And as much as the government will do whatever it can, there will still be errant personnel, errant people, who will come and intrude, break the law, and will be amongst you and possibly infect you. I am told of this story of this truck driver or somebody who got a lift with a truck driver here in Machakos, came up to Kathiani to see the sister, and you know the story. You know what happened. So I am just saying that let's not think that because Machakos has only got 3 cases so far, that you are safe. I want to tell you to keep it up. Keep up the distances, keep up the hygiene levels, keep up the masks, and that way we might just be able to stay there. To keep the numbers this low, the residents are urged to continue adhering to the containment measures and also exercise the Nyumba Kumi initiative of policing. If you see somebody in your area who has been to Mombasa lately, Nairobi, and other places, you should raise the alarm. I am not saying that you start lynching anybody or beating them up. No. But just raise the alarm. Let us know so that we are able to contain the situation. We have noted, however, with concern, that some of our people are reluctant to seek healthcare services at our health facilities for fear of contracting COVID-19. I want to inform and assure our people that all services are continuing as normal in all health facilities. And I particularly want to appeal to mothers to seek maternal, child, and immunization services for the well-being of our young ones. We have designated COVID-19 specific hospitals in all counties, while the remaining facilities will continue to provide healthcare services separately, and therefore people should have no fear whatsoever. Regarding the COVID-19 situation, we have in the last 24 hours tested 2,567 samples, out of which some 52 people have tested positive for COVID-19. This now brings the total to 1,161 persons who now tested positive. The cumulative tests so far are at a high of 55,074. In terms of the spread, Nairobi has a higher number this time with 23, Mombasa with 7, Busia with 7, and I would like to urge the government of Busia County to become extra vigilant and extra careful because it is a border point. There are a lot of truck drivers in Busia, and you can see that the figures in that county are beginning to grow. On our part, the Ministry of Health, we will take all measures possible and necessary to support Busia County so that the figures in Busia do not continue to grow. What we have done is that we have told the truck drivers to test 48 hours before you get to the border. Don't go to the border to be tested at the border. Because if you get there and you have to wait for your results, then you are just going to clog up the border. And you cannot enter in Uganda, you cannot enter into Uganda unless you have got a COVID-19 negative certificate. So we are urging our drivers to take the initiative and test earlier. If you are heading for Namanga, if you are heading for any border. Further, we have instructed that we are not just talking about testing drivers, cargo drivers who are moving and traveling outside the country. Anybody, any driver, any cargo driver leaving a designated area must be COVID tested. You cannot leave Mombasa unless, and you have got a cargo, unless you have been tested. because other people are not traveling from Mombasa. It's closed up. So what we are saying is that for you to protect the others, because it is you who should hold the responsibility of protecting the others. So if you don't know that you are negative, then you should not leave Mombasa. If you don't know that you are negative, don't get into your truck and drive to a border post and then just stop your driver there, your truck there and wait. So I want to, again, continue to urge our people to be careful. There are areas that we are getting concerned about. For instance, the area of Kibera is beginning to be concerning. There's an additional 8 cases today in Kibera, and that is something worrying considering the population that is in Kibera, and further measures may need to be taken in that place. And we will do so as our scientists move around, the doctors move around and advise us. We make decisions on the basis of scientific finding. Again, in Mombasa, the cases there, normally from the old town, we have got cases from Jomvu, Mvita again, but we are happy that Mombasa is taking it seriously and containing. Our only concern is those people who are dying at home. Those people who are not going to the hospital. You are sick and you are afraid to go to the hospital. We have been told by our doctors very clearly that the disease affects people a lot more if somebody is at home, sick, and those taking care of the individual will fall sick. I think it is very, very important to appreciate that you do not want to become a problem for your family, and therefore take it seriously. If you are feeling unwell, please visit the hospital. I also want to inform the public that we have discharged another 5 patients who have recovered from the disease. And therefore, we have now got about 380 persons who have recovered. Our case fatality continues to be low at 50 persons, and we pray to God that this continues to be the case. I want to say that all this, the containment that we have had, it would not have been possible without the dedication and commitment of our health workers. My friends, we salute you. Finally, I want to thank Machakos Governor Dr. Alfred Mutua and all the people of Machakos for the work they are doing in this fight. It is not by chance that Machakos has such fewer cases. It is due to the hard work and the cooperation between the county government and its residents, as well as the national government. I can tell you for a fact that if anything is amiss here, Dr. Mutua can call me 2-3 times in a day. He doesn't leave anything to chance. I also want to thank Kenyans in general for their understanding and support as we continue to tackle this enemy. I appeal for vigilance and urge everyone to strictly observe the containment measures that we have advocated. I want to say as I stop that devolution works. There were those naysayers who in the 2010 Constitution started wondering whether we should be devolved at all. I can tell you without any fear of contradiction that what we have seen in Machakos, we would never have seen if it was all being managed from Nairobi. That is a fact. Hakuna mtu hawezi kuona hiyo. Hii hospitali ilikuwaje wakati kulikuwa the management all the way from Nairobi? Hii hospitali ilikuwaje? Si ilikuwa mbaya? But when we look at you today, even when you look at your faces, we can tell that you are happy working in a clean hospital. The possibility that there would have been a cancer center here in Machakos at this time would have been very, very difficult. And I want to congratulate you once again, Governor, for the initiatives that you have taken and for your forward-looking and the way you manage your county. I have just come from a very nice building called the White House, I'm told. And I can tell you for sure, it's better than my office. And, you know, there will be those who will criticize the governor and say, why are we building a big thing like this? In my community, as I was explaining to the governor, we have a saying, Kedu kinene kiuru no kiroda. Maybe, Governor, you can translate that one.
Kindu kinene kidhuku no kitau. Kitu kibaya
Zindio
kikubwa ni kidonda. Hiyo ingine yote ni sawa.
Umekubaliana na hiyo maneno? Yes, kwa hivyo is good, and I like the way that the government of Machakos is very futuristic. You see far. The benefits of what Governor Mutua is doing is not him who is going to benefit. On the contrary, whoever will be the new governor of Machakos should bring a mbuzi for the old governor because of the building. He'll just occupy a nice place. So watu wa Machakos tunataka kusema hongera, muendelee vile vile hivyo hivyo mnafanya, na umoja ni kitu ya maana sana. You know, the problem has been that in a lot of counties there has been fights between members of parliament, between the governor, the senator, and when people are fighting, we cannot see progress. But when people are working together, then we can see the kind of progress that we are seeing here in Machakos County. Asanteni sana, and thank you all once again. Thank you, healthcare workers. Let's continue working in that spirit. As usual, I'll take a few questions, maybe after yes, Governor Mutua wraps up.
Before the questions, I want to thank you very much. Nimefurahia sana anapoongea Kiswahili kwa sababu akiongea speed kidogo fupi atakuwa na sound kama Mwai Kibaki. So I thought the accent is right there, and we both worked for former President Mwai Kibaki very well. I want to thank you also for recognizing our health workers, and also thank the President for the initiative to pay allowances to our health workers. And I wish to confirm that Machakos health workers have been paid the extra allowance that I promised. So wamelipwa yao, wako sawa as we wait for the program to continue. We are waiting, we'd like to get more support in PPEs and others, but we've given out tenders. We are getting 10 more ventilators, we are getting more PPEs, we are getting equipment and things to ensure that we are okay. And we've contracted our vocational training colleges to manufacture masks. My plan is within a month or so or two to give each resident of Machakos County, nearly 1.5 million, a mask, including children. So they can all have a mask, and more for the others. Now, to go, I want to announce two things as I conclude. One of them is that we had confiscated border borders. Our committee agreed that now with the border borders that are confiscated, kwa sababu hawakuwa wanajipanga vizuri, kwa sababu waziri amekuja hapa nimewahurumia kidogo, na tumewahurumia, nataka muendelee na kazi. Kwa hivyo bodaboda zile zimechukuliwa nearly 200, mtarudishiwa kuanzia Tuesday ndio muendelee na kazi. Lakini mkirudi tabia mbaya bado zitachukuliwa. Yale magari ya pombe ambayo yalikuwa yamesimamishwa asije kuanzia Jumanne inayokuja tuwaruhusu mje, but targeted, na tunawapatia orodha ya mahali ambapo mtaweza kuja. And to add on, to make a decision we've been discussing, and to add on to what the minister has said, kama wewe ni dereva wa truck na unakuja unapitia Machakos na umetoka Mombasa, sasa tuta make sure kwa boda ya Machakos, kama hauna barua ya kuonyeshana umepimwa na uko negative umetoka Mombasa, hatutakuruhusu kuingia Machakos na kupeleka ugonjwa the rest of the country. Kwa hivyo utakwamia hapo na urudi. And I want to recognize my friend Dr. Molo who is here from Makueni. Kwa hivyo naomba hata Makueni muwasimamishe huko Makueni, watu wasifike Machakos. Kama huna barua na truck driver ya kuonyeshana you are negative, do not think of coming to Machakos. It will be one of the documents that you will require. And lastly ni kusema Kenya imekuwa nchi ya matajiri wachache na maskini wengi. Lazima tupeane huduma kwa wananchi. Healthcare ni ya wananchi. Kama vile tulisema corona imekuwa hapa, hakuna kwenda ngambo, tuko na wewe hapa. Lazima tujihimize kabisa. Kwa hivyo nauliza watu wangu, msiogope kuja hospitali. Hospitali zetu ziko sawa, kama waziri vile amesema. Kama watu wa corona wanapimiwa, wa COVID wanapimiwa pale stadium, sio hapa. Kwa hivyo ukiwa mama mjamzito, uenda kwa clinic ukavaa. anduma corona maiku kasibitali meku yote stadium na kundukungi uko sayeba. Unajua maternity yetu imejaa kwa wakati huu. Kwa hivyo nataka wakuje hapa wapimiwe hapa, na itaendelea kujaa kwa sababu with an improvement of the economy also people improve and you get more people being born. So Waziri, asante sana. We are very happy you're here, and so I hand over to you for any questions to any of us.
I also congratulate you for the increased population.
Yes.
Sema kura zetu zitakuwa nyingi hapa. Governor Mutua, to support your effort and to continue to support, I did not come empty-handed as I came. We have brought you some 500 PPEs.
Oh, very good.
Alongside some blankets, some sanitizers, about 1,000 of them, paracetamol, and mambo mengi tumekuja nazo, na kama haitoshi tutalete zingine.
Asante.
Sio ni sawa?
Asante.
Now, so I'll take a few questions, and today I want to very proudly say that I have got a team from our ministry, Professor Nangili, who is the national head of all nurses, ni nasi mkuu. Then next to her is Kas Mwangangi, who is serving today in three. Today she plays 3 roles. The first one ni kutuonyesha hospitali hii. Manake si alikuwa hapa yeye, ama mjui hivyo. She was attached to this hospital because she is a medical doctor. So that was her first role today, to come and show us around and to tell us whether there is an improvement, and she has confirmed. The second thing is that today she is also the doctor. She is the one who is going to respond to the questions that relate to intricate medical issues. And finally, she also comes here as a chief administrator in my ministry. Kwa hivyo, Dr. Kano Oguna, government spokesman, please endelea.
Question is there a shortage of septin drugs for those using, for those living with HIV/AIDS, and the shortage has it been caused with the current COVID-19 pandemic? And the last question is, we know the president of Madagascar had offered each and every country in Africa an offer to try their drug, the COVID-19 organic drug that they say really works to deal with the COVID-19. As a government, MOH, have you considered the offer? What do you make of it so far?
Swali langu la kwanza, waziri umesema ya kwamba umekuwa na visa vya watu kufariki kutoka nyumbani, na hivyo basi kumaanisha ya kwamba wanahatarisha maisha ya wengine zaidi. Hivyo basi tungependa tu kufahamu sasa ni idadi ya watu wangapi ambao wamefariki kutoka pale nyumbani, na vile vile ikiwa wamefariki, je, mmeweza kuwapata wale ambao walitangamana nao, ama katika wale ambao tayari sasa hivi wana virusi vya corona ni wangapi ambao mtasema waliambukizwa virusi baada ya mtu ama jamaa yao kufariki kutoka nyumbani? Na mwisho kabisa, tumekuwa na malalamishi kutoka kwa wananchi kwamba wanapokwenda kupima corona basi kuna foleni ndefu, wanasalia pale kwa muda mrefu, na wanasema ya kwamba wanataka kujua ni muda gani ama ni kwamba vifaa vina matatizo.
My name is Chamtai Goin from Citizen TV. I have 2 questions. We are aware that you have received quite a number of ventilator prototypes. How many have you approved, if any, and when will the production start? And the second question is on the issue of local manufacturing of PPEs. what is the capacity that informs that statement that there will be no shortage in future?
Asante.
Asante Bwana Waziri. Jina langu ni Waweru Nyambura kutoka Inoro TV. Swali langu kwako ni kuzuia vifo vya nyumbani. Wasia wako ni upi kwa Wakenya ambao wanaona wenzao wakikufa na wakiteseka na hawezi wapea huduma ya kwanza kwa uoga wa kupata virusi? Kupatia kisa ambacho kilikuwa kule Gatanga ambapo wanakijiji waliona wenzao akiwezwa na dalili za huu ugonjwa na hawakuwa na la kufanya ila tu kumwangalia. Na kwako gavana, baraza la magavana limekuwa likisema kwamba mgao wa pesa za county ukichelewa unafanya matayarisho ya kupigana na ugonjwa huu yawe ya chini sana. Kwa sasa hali iko vipi? Mmepata pesa, matayarisho yako vipi? Asante.
Okay, let me just respond to let's just respond to the ones that have been raised, and I want to start with the last one and then ask my colleague Dr. Mwangangi to respond to the issues of the sicknesses. Number one is that the ventilators, the prototypes of the ventilators have not gone to production stage yet. This is a very critical equipment in management of any disease, and particularly COVID-19. And therefore, we need to be very vigilant. We need to be very, very careful, because if you are not very careful, then the machine that is supposed to save life can itself kill. So we need to be careful about it. We are going through the processes. By the time we actually allow them to be used, they will also be WHO standards. On the issue of the PPEs and local manufacturing, you know, there are only two factors that really make a difference. The first one is money. If you have the money to buy them, that's one. And money is not always in supply, as you well know. But what I would like to do at this juncture is to appeal to the COVID-19 fund that was launched by the president. They have collected quite a bit of money, and I would urge them that now we start putting some money into actual PPEs. I know that they have been going the processes of tenders and so on, but this is an emergency, and I would like them to fast track their support so that we can get some PPEs. We have been very lucky because we have got private organizations that have supported the government, particularly I can mention Airtel and World Vision, that gave us support by way of presentation of locally manufactured PPEs. And that has been a great support. So hopefully the fund, as well as the government, will do so. The third item that I think is, the second item that's critical, is the issue of capacity. Capacity. And I can tell you that the organizations or companies that we have approved to make PPEs, and I can tell you that the PPEs, just to sidetrack a little bit and talk about the PPEs, that the PPEs that are being made locally were passed by KEBS themselves, and then again, Dr. Nandili, who is here, and her team went visiting the factories, retested the materials, just to make sure they are properly hydrophobic and they are good equipment. And I can tell you also that what I did is I also tried to get the ones we had imported tested by KEBS, and they failed. So the PPEs that we are making locally are superior to the PPEs that we were importing before. It is just thanks to God that our doctors have not been falling sick. Some of these imported PPEs have been really below standards. So those two factors, the capacity that they have is enough. We can produce upwards of 25,000 PPEs per day with just the companies that have been approved by the doctors. And I want to insist that doctors will not be exposed. We will not agree. We will not accept as a ministry any materials that the doctors themselves are not comfortable with. They are the ones who are on the front line. So people just can't come and tell us that now we are giving you PPEs. No, pana. The doctors have to be comfortable with the use of those PPEs for us to agree to use them. So on the issue of Madagascar, somebody raised about some medicine that is in Madagascar. I even heard there was another one in Senegal. There is Madagascar, there is Senegal, and only God knows where the next one is going to be. What I can say is this: I do not want to denigrate whatever is coming out of Madagascar. Maybe it works for Madagascans, maybe it doesn't. I don't know. And the last thing I am going to do in this country is to allow anybody with any form of concussion to come and profess that these things are working before they are tested by our people, before they have done through thorough tests in our laboratories, so that we agree that this amounts to medicine. Because if you are not careful, you can do some very crazy things. So, no, we are not using anything that is not approved by the Kenya government, and we do not want to experiment with our people. On the issue of, you said, Odol, you are asking about Mandera. I'm going to respond, I'm going to ask Dr. Mwangangi to respond.
Thank you, Waziri, and allow me to greet my people in our language. Gani museo? Namabinda onde? Thank you so much. Let me jump into the first question by Vincent Oduor on cholera. Indeed, we have reported that there are cholera cases in different parts of the country, and it's important to understand that cholera is one of the diseases that is actually notifiable under the World Health Organization. And so the figures that we are sharing are actually cumulative figures of our surveillance activities for cholera, and not just only cholera as a disease, but also malaria, yellow fever, and other diseases that are important when it comes to public health. And so we do stand by our figures, and these figures are factually corrected in collaboration with county governments and national government, and they do represent cumulative figures in terms of our surveillance for cholera. There's another key question that has been asked regarding our patients who might die at home. Indeed, it's very important, as Waziri has insisted. We want you to seek care. Come to the hospitals when you think you have a problem that looks like it could be COVID-19 or corona, kuja hospitali. And when you come to the hospital, 1, you protect yourself, 2, you protect your family. Then 3, you also protect your community. And one important element that we are noting is that the deaths that are happening at home, Kenya actually has a mechanism how it is able to tally for deaths that happen both at home and deaths that happen in health facilities. And so this is a mechanism that has been activated, and we are following up on all the deaths that occur in the country, whether in the health facility or at home. There's a third question that was asked, and I think Waziri has emphasized on this issue several times when it comes to stigma. Corona ndio ni ugonjwa ambao tunauogopa, lakini ni ugonjwa ambao we can be able to mitigate and take care of. As long as we come forward and we manage the condition by observing social distancing and by washing our hands and seeking care. Ukiwa nyumbani, kuna mtu ambaye ameugua huu ugonjwa ama kuna shida yoyote ambayo inahitajika, upige nambari 719. Ukiwa nyumbani, don't be afraid of the patients. Dial 719. We actually have 60 doctors stationed at the call center in Nairobi and collaborating with our county departments of health to be able to ensure you can get the care that you need. So when you have someone in your household, we are really pleading and saying, do not stigmatize. Do not stigmatize. Let us not go back to the days when we had stigma when it came to HIV in the country. Let us learn to take care of each other and be our brother's keeper. Asante.
Finally, on the issue, and I think, Waweru, you are the one who is talking about Gatanga. This is happening in a few areas in the country. And I just want to emphasize once again that tafadhalini, kwa sababu hii ugonjwa ni ugonjwa ambao kila mtu anaweza ungua. Kila mtu anaweza umbukizwa. Kwa hivyo, msiogope, ile tufanye kazi pamoja, tusaidie wale ambao wanahitaji kusaidiwa. And it is not just a question of just sickness. As a society, this is a time when we come together. You know, don't watch your neighbor because he has lost a job and he needs help or she needs help. Help them. Leo ni yeye, kesho si ni wewe. Kwa hivyo tusaidiane ndio tuwe nchi moja. Because, as I have repeatedly said, if we behave normally, this disease will treat us
abnormally.
Thank you.
Asante. Kulikuwa na swali moja kuhusu mgao wa pesa. Ni kusema tukimalizia, sijui kama umemaliza, nimalizie kabisa. Ni kusema kwamba ndio fedha zinachelewa kutoka katika treasury ambazo zikichelewa zinaleta tatanishi kubwa sana katika kaunti zetu. Hapa Machakos mgao wetu umechelewa kwa mwezi mzima. Kwa hivyo hivi sasa unaona tuko hivi tunangojea fedha zije, tunaendelea collect, lakini tunaomba sana. Tumesikizana sana na treasury kwa muda mrefu kama magavana. Tukasema weka tarehe, kama ni 15, kama ni 30th. Kama mtatupatia every 2 months mtuambie. Lakini tukikubaliana ni tarehe 15 na fedha hazifiki ama tarehe moja hazifiki, zinachelewa mwezi mzima, basi inatufanya basi tuanze kwa accrue pending bills. Kwa hivyo nikuuliza kwamba tuwe ni nchi ambayo ina msimamo, tukisema ni jambo fulani liwe ni jambo fulani. Nimesema asante sana Mheshimiwa Mutai Kagwe, rafiki yangu kwa muda mrefu, na kusema I'm happy you're here because my health workers are the best in the country. You know, they are very good and I love them very much, and we work closely together and they work beyond. Wengine wakienda strike, they give me the benefit of the doubt and they come to work because we care about each other. Kwa hivyo nakushukuru sana, pia nakutuma umshukuru rafiki yangu Rais Uhuru Kenyatta, mwambie amefanya kazi nzuri. Mpango wake wa kupigana na ugonjwa is working in Kenya. And Kenya is far ahead of many other African countries because of good leadership by the president in terms of fighting corona and many other things. Asante sana na Mola wabariki. Na wale wageni wamekuja hapa kutoka Nairobi, tafadhali msiondoke bila kwenda hapa ununue kitu Machakos, ukule mkate kidogo, ukunywe soda. Leave some of that Nairobi money in Machakos. It is good for our economy.
Okay, asante. Sasa Governor, if you accompany me, I'll hand over the gifts that I brought to you.
And we are very grateful for these gifts.
Asante.
Very, very grateful. Thank you.
Thank you. Asanteni sana.
Basi pale gavana wetu ataweza kukabidhiwa bidhaa ambazo zimetangazwa tayari, na ningependa kuwaomba wale wengine to keep distance. Tafadhali, let's maintain our social distance as we witness, as you try to get the best shot. Kindly maintain your social distance. Basi pale ameweza kukabidhiwa baadhi ya vifaa ambavyo vinatumika katika mahospitali, haswa ikiwa ni vifaa vya kujikinga.
We have been talking about PPEs. I don't think you have seen what a PPE kit is all about. So I want to show you in this particular one what we are handing over to Mutua.
This is the bottom. There is one trouser. This is the top. This is the overall that you put on top. This is also an overall, and it has the back end. This is a full suit gown that you put on. And these are bootlegs for the shoes that you put on.
Umejionea yenyewe. Kwa hivyo tukisema maneno ya PPE is not a joke. It's a whole set.
And manufactured in Kenya.
Very nice. We can show them. Asante sana. Manufactured in, made in Kenya. Made in Kenya. Very interesting.
I help women find independence.